effect of the InsaFlow Synergy port will be more profound in surgeons that are just coming out into practice. Someone like myself who's done thousands of cases, you're beyond the learning curve for a lot of cases. However, for someone who struggles maintaining pneumoperitoneum or has difficult cases or maybe doesn't have a skilled assistant that's working with them, this is a key component that they should add to their arsenal, because the holy grail of minimally invasive surgery is to maintain pneumoperitoneum. If you can't do that, you cannot operate. And the last thing a beginning surgeon would want is difficulties maintaining pneumoperitoneum. So I think that this is something that all surgeons should use.
I've utilized the Synergy several times and found it to be extremely useful in maintaining pneumoperitoneum during the procedure. When we opened up the vaginal cuff and removed the uterus tubes and ovaries, we didn't have to place anything into the vagina to maintain a pneumoperitoneum, which certainly saves some time. Once you take the uterus out, you don't have to wait until there's a placement of something to hold the gas from escaping into the vagina. Sometimes when you're putting in trocars, if your incision is a little bit too big, you might have gas escaping from around the trocars. And with the Synergy, that no longer is a problem. You don't have to put a stitch in, you don't have to put clamps around the incisions to maintain the pneumoperitoneum. So there's so many benefits to this new Synergy device of maintaining pneumoperitoneum. In fact, during the procedure, with the vagina not having any device in it to maintain a pneumoperitoneum and using suction, there was no loss of pneumoperitoneum. It's an amazing device.
When I started using the Synergy, I have to admit, I wasn't convinced that it would be a benefit to us. It seemed like it was one more plastic trocar, and that the trocar wars in most hospitals are troublesome. And so I didn't go into it with high expectations, and we tried it in a couple of orientations. I think each surgeon's going to have to trial and error it, but we found using it in our simple instrument that holds up our liver, for example, that allows us to put the gas in one port. We're not constantly changing the gas from port to port. We're not seeing reductions of flow. Every time I put a stapler in a 12 port with a stapler, the flow goes down. And when we stepped back and looked at it, prior to that new port, we were changing the gas, and still change the gas 2 or 3 or 4 times per case to different ports to try to keep the flow going. And it made a big difference. It had tremendous flow. I don't think we ever got below 15 liters per minute. I mean, it was we tended to use more gas because we always had good gas inside the belly. And we didn't have to continually change. And then finally, we never had any humidity issues. By keeping it away from our camera ports right from the beginning, we were able to put it up out of sight, out of mind, and it flowed constantly. So for us, it's going to be a routine part of our procedures. Now, the fact that it's, at least for us, is going to end up being relatively the same cost when we start taking a port out of the picture, that makes it even better.
I think that in general, the InsaFlow products or the Synergy product, you know, at the end of the day, having humidified air, there's no downside. It doesn't hurt anything. It's like putting in local anesthesia into an operation. There's really no downside. There's only upside. There's no reason not to use the device.